Hey, everybody, we'll be starting in just a couple minutes. We're trying to upload a couple more presentations. So thank you for your patience. All right, good afternoon, everyone. I'm going to go ahead and call the meeting to order. Welcome everyone in the room and everyone online to the county's Intergovernmental Relations Committee meeting. My name is Mark Jarrell. I have the honor of chairing this committee, and I am going to have my colleagues introduce themselves at this time. We'll start with District 5.
Good afternoon, I'm Laura Meyer and I represent District 5.
District 6.
Good afternoon, everyone. I'm Susan Rodriguez McDowell, elected by the people of District 6.
Thank you. And I failed to say that I've been elected by the people of District 4. Right now, we will turn it over to Starla, who will finish conducting introductions for those in the room, online, staff, and everyone else. So thank you, Starla.
Thank you so much, Mr. Chairman, and good afternoon, commissioners and everyone. I also want to apologize for the late start. We have some visitors here today that you'll meet in person, and we've been onboarding them. Again, I'm Starla Tanner, Intergovernmental Affairs Manager for Mecklenburg County. I'll turn to our deputy county managers to introduce themselves and staff, and then I'll introduce our guest.
Good afternoon. I'm Derek Ramos, Deputy County Manager and Chief of Staff.
Good afternoon, Anthony Trotman, Deputy County Manager.
Our department directors and staff.
I'm Sonia Harper, Director of Criminal Justice Services.
Good afternoon, Tracy Campbell, Senior Health Manager for the Office of Violence Prevention, Mecklenburg County Public Health.
Good afternoon, Kimberly Scott, Assistant Health Director for Population Health Division within Public Health.
Good afternoon. My name is Chantel Lowry. I'm a Health Program Supervisor for the Office of Violence Prevention with Mecklenburg County.
Rebecca.
Good afternoon, Rebecca Herbert, Community Relations Manager, and Mike Holder.
And then we also have our wonderful IT staff colleague.
Mike Hensmith, County IT.
Okay. Our next guests to introduce themselves are our, I'm going to save our new team for last. I want to invite our guests here from the North Carolina Association of County Commissioners to introduce themselves. We're happy to have them here today for a series of our onboarding meetings.
Thank you for having us. I am Amber Harris. I am NCACC's Director of Government Relations.
Good afternoon. My name is Destiny Everett, and I'm NCACC's Government Relations Project Coordinator.
Pass it next.
My name is Ricky Singh. Great to be here. Executive Director of My Brother's Keeper, Charlotte Mecklenburg.
I'm delighted to give our new state lobbying firm representatives a chance to introduce themselves after a thorough RFP process that included several of our division directors and vetting several different vendors. We have a great team that we've chosen to represent us and work alongside me and pursuing your legislative agenda priorities to represent us in North Carolina at the North Carolina legislature. So I'll invite the mayor next and team to introduce themselves.
Thanks, Starla. It's good to be with you. I'm David Farrell. I'm an attorney and lobbyist in our Raleigh office. Our firm is Maynard Nexon. We've got a Charlotte office here right downtown. We've been representing clients in the legislature since the late 90s, and we appreciate the opportunity to represent the county. I'll let the rest of our team introduce themselves, but it's good to be with you. Thank you.
Thanks. I'm Chase Horton, and I've been with David Farrell at Maynard Nexon after working in the Senate for a year and a half since February 1st of last year. So 1 year anniversary.
Hello, everyone. I'm Clark Reamer, and I've been with Maynard Nexon since about mid-November last year. So the new guy to the group, but before that, I was at the State House staff for about 10 years, and 7 or 8 of those with Representative Sain, and last 4 or 5 on the appropriation staff, working on the state budget.
Thank you. They've been with us since 8:30 this morning in their onboarding process. So again, we rushed down here. We're in between here from department directors. I know we also have another community member. We'll give them a chance to introduce themselves. And then, Mr. Chair, I think we have another board member that's online and a couple of guests there.
Hi, Tanya Jameson with Leading on Opportunity.
Great. So we have one of our commissioners, I believe, is online. So we'll give Commissioner Powell a chance to introduce herself.
Good afternoon. This is Mecklenburg County Commissioner Elaine Powell, representing North Mecklenburg, which is District 1. Thank you. Thanks for inviting me and recognizing me.
Thank you, Commissioner. I don't have the screen in front of me, so I'll ask any other elected officials to introduce themselves. I believe we have maybe our school board chair that's on the call. Are there any other commissioners on the call I'd like to ask first? If not, board member Sneed, Chair Sneed, will give you a chance to recognize yourself, to introduce yourself.
Good afternoon, Stephanie Sneed, Chair, Charlotte Mecklenburg Board of Education, elected by the residents of District 4.
Thank you, Chair Sneed. And then, Mr. Chair, would you like just the other community members to introduce themselves before we launch into the agenda? If we can go around, or would you like to?
You know what we'll do is we're running a little bit late. I just want to thank the community members for being here. Obviously, we really appreciate it, but we really need to get the meeting started. Do want to try to circle back to them if possible, because this is a median heavy discussion, and community input is something that we all seek. So thank you all for joining us again. Today's discussion, I do want to set it up before we go to the presentations. We're talking about community violence prevention, and the county has a specific strategy that we've deployed. And so the committee has asked for an update with respect to that strategy. So we will hear from staff around that. The committee members will ask questions, and we'll try to get through this. Before we get started with the first presentation, I do want to say, because this is such a heavy and meaty discussion and topic, we know today that all stakeholders that need to be at the table are not here and are not presenting. And so the community understands what we plan to do is to take this in chunks with multiple stakeholders on multiple committee days moving forward. So we'll have the city provide an update. We'll have the community provide us an update. And so that we can get a comprehensive look at what this issue of violence looks like, how we're all attacking it. But the goal of this committee is, how do we bring it together? So I hope that makes sense to everyone. And with that being said, I'll turn it over to Starla to tee up our first presentation.
Thank you, Mr. Chairman, and I'm delighted to introduce Tanya Harper, our Director for Criminal Justice Services. She'll be followed by Tracy Campbell from the Office of Violence Prevention. And Mr. Chair, are you taking questions at the end of each presentation or at the end of both?
Let's take questions at the end of each presentation, and then we can open it up to the community based on time. Okay.
All right, well, thank you for having me this afternoon. So I'm going to provide you really a brief update on some of the projects and work that are attached to criminal justice services that are related to your initiative to address community violence here within Mecklenburg County. So Mike is going to advance the slides for me because my little clicker here is not working for me. So we can go ahead and kick off with the next slide, please. Thank you. So, within Mecklenburg County and of course within criminal justice services, we really tout ourselves on making data-driven and data-informed decisions. And what I'm going to focus on, here are some of the things that we have coming down the pipe. You guys have heard from me on several occasions on a lot of the things that we've had, historically have done within the department. I think you are familiar with the work that we've done with data, the criminal justice data warehouse within CJS. The data dashboards that we had published a couple of years ago to provide more, close to real-time data to the public so that we're able to be more transparent about the work that's happening in the justice space. But a couple of things that we have that are currently, in the works or, tied to this research and data piece is the first here I wanted to highlight. And this right here is a study that was recently conducted by the University of Missouri at St. Louis. And it's titled Redefining Public Safety. And I've provided you all the executive summary of the full report. The University of Missouri St. Louis was available to us through our work with the MacArthur Foundation Safety and Justice Challenge. And so their researchers there selected Mecklenburg County, Missoula County, Montana, and then St. Louis County, Missouri, to conduct, put together this report to really get the perspective of members of the community as to how they define safety in their community. And so they have just recently completed this after a year's long work, and we'll actually be presenting the full findings of this to the Criminal Justice Advisory Group, or the full group, at next week's meeting. But what I provided you there, again, was the executive summary of that report. Over the course of the year, what the researchers there at the University of Missouri St. Louis did is here in Mecklenburg County, they spent a significant amount of time talking to members in our community. So they did this through surveys, they did this through focus groups, they did this through individual interviews with the intention of really wanting to get, a feel from them as to, again, sort of gauge their view of safety, what's happening in their communities, and what they think were potentially some responses that leaders could have in order to, again, redefine public safety in their communities. And so, I don't want to steal the thunder of the researchers since they will be here, next week presenting to the full CJAG. But what you will find there in the executive summary were some of those key takeaways and some of those general recommendations that they have for Mecklenburg County as well as the other two sites. If you are interested in seeing the full report, I can send that to you. Again, it's a pretty meaty document, but there's also a separate carve-out document that contains just Mecklenburg County. It itself is a little lengthy, but I can certainly share those with you if you really want to get really into the weeds of what their findings were. Next slide, please. The next piece of work that's tied to criminal justice that we're working on, these two projects here that we'll be launching here soon are tied to the federal omnibus funding that the CJS received this past year. Just as a reminder, we did receive approximately $1 million through the omnibus bill to be able to support expanding our data and research capacity within CJS. One of the primary projects with this are the research practitioner project, which basically will allow the department to work with a research partner to conduct really what we believe will be the first real kind of crime study for Mecklenburg County. Again, CJS and Mecklenburg County, we are a very, data rich, jurisdiction. And so we really have roughly about 30 years worth of data here within our county. And so partnering with an organization, what this is going to allow us to do is to really delve into that data and tell the story of Mecklenburg County, to be able to talk about crime trends and what we have, what we've actually seen within our system. We'll be able to really also take a look from the perspective of how Mecklenburg County has changed over the decades with our demographics and our changes in population. So we're extremely excited to be able to do this. The RFP for this will be released soon. I'm hoping tomorrow. I don't know if they'll get it out, procurement to get out the door that quick, but it'll definitely be out this month, the month of February. So again, we are extremely excited about that and the work that I think that we'll be able to produce as a result of that. The other piece of the project is a data enhancement and visualization. And so, again, as I'd mentioned, and I've presented before you before, again, we have done quite a bit of work within CJS to expand the capacity of our data warehouse, to make the data that exists in the warehouse more usable. And we have produced a variety of different dashboards, over a dozen that we have made fully public to be able to allow folks to really take a look at what's kind of happening in the day-to-day within our justice system. What these funds here will do will allow us to either, to expand it even further. So we're referring to that within the department as, data warehouse 3.0. And so again, with this piece here, we do fully intend to be able to work with primarily the members of the Criminal Justice Advisory Group as we're building out these new, dashboards and looking to increase the data capacity and the utilization of data, to also to be able to create dashboards and kind of tie data together that our executive committee of our CJAG will find useful in sort of like the day-to-day work and what they do in each of their spaces. And so again, we're excited about this piece, and there will be an RFP released later this year. We haven't kind of pinned down the exact timeframe that one will come out. But again, these are the two real kind of primary, data research pieces that we've got coming forth. Next slide, please, Mike. Housing, I'm not going to spend a lot of time on housing because you guys just heard from me last week at the board retreat on this one here. But again, from the, crime prevention standpoint, when we look at recidivism with our justice population, again, housing and basic needs, there's a very kind of close correlation there between economics and crime. And so for us within the department and what we have seen year after year, again, we have made a significant investment in housing within CJS, primarily with our reentry population. And so, currently within the vendor housing network that we have, there are 10 houses within the network that are fully supported with county funding within CJS's base budget. Through the ARPA dollars that the county was able to provide to the department, we've opened an additional 15 houses. We currently are on track to have 3 more houses added to the network by the end of this month. And we're currently in negotiations right now with some additional vendors to bring another 5 on board. So again, we're pretty excited about, the direction that's moving, and that has been extremely impactful for our work within the department, and of course, for the folks that we serve. Next slide, please. The other piece here is I just wanted to give that reminder of, the work that of the Juvenile Crime Prevention Council, which is of course one of your advisory boards. Through the JCPC, we award over $2 million each year to community-based programs here within Mecklenburg County to support youths and their families who are justice involved or at risk of being justice involved. And one of the handouts that I provided you there is the directory of programs that are currently funded under fiscal year 24. There will be an RFP that will be released later this month by the JCPC. They're convening next week and will determine the actual release date at their meeting next week. So that RFP will go out. Again, it's a little over $2 million that'll be out there and open for any community-based program that it serves justice-involved youth to be able to apply for those funds. Next slide, please, Mike. Another quick piece I wanted to touch on is, again, the work of the Criminal Justice Advisory Group. And so for folks in the room who may not be familiar with what we reference as our CJAG is our Coordinated Criminal Justice Council here in Mecklenburg County. The CJAG and the CJAG Executive Committee, more specifically, this is the leadership of each of your primary justice agencies in Mecklenburg County. So this is your chief of police, your elected DA, your public defender, your head of probation, your chief district court judge, your senior resident superior court judge. Goodness, I'm hoping the towns, the police chiefs of the towns are also represented there. In CJS, we convene that group and we resource and support them. DCM Ramos serves as the chair of that group. But this, the CJAG right now, the executive committee in particular, they are currently working on their strategic plan. Their goal with the strategic plan is to identify, those primary areas of impact within the local justice system. And then from there to be able to identify and guide work that will reflect what's occurring within the system. And so this plan, again, it's underway. They will be highlighting their primary goals and objectives to the full group. They will also be opening that up for some feedback from our community engagement task group as well. But again, the work of this group here, really is focused on what are those things that our leaders, CJ leaders, are in fact identifying as being the most impactful to the local system. Next slide, please, Mike. And then the other I wanted to touch on is the CJAG's Community Engagement Task Group. So this group here is a subgroup of the CJAG. It has been up and running since 2021. And the intention of the CJAG Executive Committee when they designed this group was really to establish it to serve as a liaison between the CJAG and the community. With the intention of this group being there to help, inform policy and practice decisions that the CJ leadership would make, but also, taking into consideration those things that the community members identified as being important to the community and where there were those opportunities for the justice system to be able to support those things that the community members had identified as being important to them. That group consists of 12 community members. These folks all have lived experience with the justice system. There is representation, of course, from the city of Charlotte, but also representatives from the northern part of the county and the southern part. With this group here, they have been doing quite a bit. They're actually an impressive group, and I think a few of you we've spotted at a couple of their events. But again, this group here has been, they have done, I think, really a great job in being able to be able to support the leadership of the CJAG. Next slide, please. Whoops. Well, I think, the other thing is with the Community Engagement Task Group, before we go to questions, is that group has established a strategic plan that was accepted by the CJAG. So they identified, wanting to have community conversations in some of those areas that are considered to be hot spots, within the city. They spent quite a bit of time in the Beatties Ford corridor, having those community discussions. There was also quite a bit of interest from Pineville, from communities there. So they went out and held some sessions there. They held a resource fair in December out at BCW. That was in response to a lot of the community conversations being focused on, juvenile crime and needing more kind of resources and supports for juveniles within their communities. And they're also in the process right now of developing a youth leadership subcommittee of their group. They want to have, more of that voice of young people into the work, particularly as they're currently working on developing their next plan, which they will be presenting to the CJAG Executive Committee. So now we're ready, I think, for questions.
All right, thank you for that. So let me just level set how we're going to do this. We will hear both presentations. Colleagues will ask a question. What I'm going to do is limit the questions related to the presentations to the committee members for right now. We'll go through that and then we'll open it up for a broader discussion. So I'll start with Commissioner Rodriguez McDowell.
Oh, thank you. Yeah, I went to the Pineville meeting once or twice, and I thought they were doing great work, and I don't really have any questions. Just appreciate the presentation. So thank you for what you're doing.
Okay. Commissioner Meyer.
Thank you. And I do have just one question. And I know we've talked about this at the retreat, but the housing, is it staffed by county staff? Is it providing all the houses that we have? Wraparound services, job placement, job training, all that?
So all the folks that are in housing, they have a case manager within CJS that works with them.
Okay.
So and that's the condition. If you're going to be in our housing, you either have to be employed or seeking employment or enrolled in a vocational program of some sort. And so they do have that case manager that works directly with them to make sure that they're staying on track with that. One of the other components that we're able to integrate into housing, and we're getting ready to launch, is in fact working in a peer support component. And so we're right now, finalizing the contract with an organization here in Mecklenburg County that will be able to provide those peer supports that will be, available to work with the folks that are in all of our houses. So they'll have that additional, support while they're kind of navigating reentry.
And there are 15 now. We're looking at 5 more.
So there are 15 under ARPA and 10 under the county. So 25 now.
25. Okay.
Yes.
Mhm. Thank you.
You're welcome.
Sonia, thanks again for the presentation. A couple things, and it's not necessarily solved to right now. So I'm going to make a data request from you. You reference JCPC, you reference housing.
Mm-hmm.
Qualitatively, I understand there's a need, obviously, for housing. We understand that. That's the conversation. What I really want the committee to understand, the community to understand, how are we measuring success?
Mm-hmm.
So when we're talking about housing people, what do the dollars look like that we're investing? So we've got $2 million out there. How many people is that helping? what does that look like? What's the targets? And, you know, what is our goal? What's the need in the community? Because I don't know. So if we could get some data around that to put some more meat on the bones, I think that would be helpful for us to understand if our investments are effective, or at least where we are to date. And if we can get any level of trending over time, I think that would be really helpful to the extent that you have it.
So I was going to say for JCPC, we can certainly do a data request to the Department of Public Safety. Because again, you know, since that falls under juvenile justice, they are the primary organization that collects that data. So we can certainly do a data request to them for those numbers. And then I think as far as housing, I mean, those are things that we can pull, you know, internally to the department.
Right. So I guess to clarify, so anything that we are actually providing funding for, we should be able to track that, correct?
Yes.
Okay, perfect. Okay, and then just the other thing is with respect to CJAG, I'm not sure who's quarterbacking that. Like who's running the show? Who is calling the plays on CJAG?
So I was going to say our chair can, yeah.
Okay.
So the CJAG has about 20 or so members, as we noted before. It's an informal advisory group. We're not taking formally adopted plans because we have elected officials. Each of them control their own budget, so we're not really creating a formalized thing that they have to do. But we do meet to coordinate. So in terms of who's quarterbacking, there is a chair who is myself. But all of us collectively talk about the issues and collectively agree on what those priorities are. So I think it's really a team-based approach from the CJAG members to collectively identify and prioritize those areas that they believe are the most important for the system.
So you're Patrick Mahomes. Thanks, Derek. I appreciate it. Commissioner Rodriguez-McDowell.
Thank you, Mr. Chairman. So it's 33 houses now, is what will be when you get the ones that are, you know, in the pipeline or whatever. So can you tell real quick how many people that is? Like how many, you know, folks can live there for 33 houses?
So I think, you know, when it comes to houses, I mean, the number of beds depends on like the size of the house.
Right.
And so we've got everything within the network from like, you know, a 2-bedroom duplex up to a 7-bedroom house. I think under like the 20, and whenever we work with a vendor, we do tell them to set the rooms up for double capacity.
Right.
It's not, you know, ideal, but with the housing need, we want to be able to house as many that we can. And if memory serves me correctly, between like the 25 houses that we have now, I think that does put us at roughly about 150 beds.
Okay. And do you have an idea of the goal you're working towards, like how many you want to have, or how many the community, like what's the, you know, how many do we need? Like what's capacity?
I think we could, I don't think we need to go over 40. Well, I mean, we could, you know, there seems to be a lot of interest in working with us in this, but honestly, like based on when we look at like, you know, projections like folks coming out of prison, returning to Mecklenburg County. And then when we look at the other folks that are receiving services under CJS that have that express need, I think if we are able to hit 40, that should hold us for a little bit. Because again, we're asking them to set up the rooms for double capacity.
So if we had 40, it would meet the need.
That should meet our need and keep us from having anyone waitlisted for housing.
Okay, thank you.
All right, perfect. So I guess we'll hear from OVP.
All right. Good afternoon, and I will give a second for the presentation to be loaded. My apologies. We will have copies of the presentation available to the committee immediately following the presentation.
Sure. And if anybody who is watching online, if you want to drop questions in the chat, please feel free to do so, and we'll certainly review those. Thank you.
So we're getting loaded. I'll go ahead and just kind of give a opening here. you should be aware of the Way Forward Plan, which is our community violence strategic plan. This is going to be an update to talk about some of those strategies that we've been able to work on that are community-based. So they're not only things that the Office of Violence Prevention is actually responsible for, but many of our community partners who have been doing a lot of great work. And so we want to do a better job of telling the story of the work that is happening and the impact that it's having on communities that we're serving. So next slide, please. So one of the first things I want to talk about is the Way Forward Plan, and we have developed an advisory board. And so the purpose of this advisory board is really to help us keep our finger on the pulse of the work that's included in these strategies in the plan. It's a collaboration with the Office of Violence Prevention, with Public Health, and Recast Mecklenburg. So Recast is resiliency in communities after stress and trauma. So we're partnering together because the work is not just looking at prevention from the standpoint of what is happening and intervening in the work as it relates to violence prevention, but looking at the trauma and the impact that it's having on communities and how are we holistically addressing those issues. So you'll see the mission and the vision for this advisory board here. This advisory board, we meet quarterly with the entire advisory board, and then we have the advisory board broken down into committees, subcommittees, and they represent all of the 5 areas of focus that are inside of the plan. And so you see our shared values here, which are community accountability, transparency, equity, safety, and sustainability. Those are the things that we're holding true to this committee and making sure that we're addressing this. So this committee thus far has been able to meet 3 times collectively for the general body. And we have about 30 participants in that advisory board committee. And then the subcommittees have met about 3 times separately. We have also identified community members to help us and act as ambassadors for the Way Forward Plan. So again, we're keeping our finger on the pulse and doing what community has asked us to do to implement this plan and these strategies. Next slide, please. Super excited to share with you Peacekeepers Academy. You may have heard me talk about this many times. It was a dream of mine, and now that we have staff, and let me stop and say that our office is fully staffed. We have one last staff member that is starting in about 2 weeks, and that person is really going to be dedicated to working for looking at research and evaluation to make sure that we are meeting the metrics that we've established for all the strategies within this plan. So this is particularly one of the strategies in the plan. Peacekeepers Academy is really designed to be an interactive learning series for community-based organizations. One of the things that we realized as we started to work with our community-based organizations is that they could use some additional supports. And so we wanted to be able to provide them with the things that they needed. So we're focusing on organizational resiliency. So this is an 8-session learning series, and they're focusing on some of these things that are bulleted here. So education and technical assistance that they're getting from experts in the field across the country that are coming to Charlotte to give them the supports that they need to continue to do the work. Looking at best practices and organizational efficiency, how to measure and track success. That is one of the key things that we found that a lot of our community-based organizations were having some struggles with. And so again, some technical assistance, making sure that they can scale up existing services and thinking about sustainability and not entering into new services without having the ability to sustain those and continue providing services. So some financial supports that they'll be receiving and some holistic public health approaches to intervening and stopping the cycle of violence. So next slide, please. This is our inaugural cohort of Peacekeepers Academy, and you'll see listed here, these are the 10 recipients. So we do have 10 community-based organizations that will be able to participate in all of these 8 sessions, and they have an opportunity to also receive up to $15,000 worth of funding to scale up the services that they're currently providing. So you'll see, I won't go through the list since they're there listed for you, but we are excited. They are doing well in this cohort, and we look forward to hosting 2 additional cohorts in the coming, one before the end of this fiscal year and another in the next fiscal year. So in total, we should have about 30 organizations that we're able to support. So next slide, please. So the next initiative that we have that is also a part of the strategy within the plan is our 100 Youth Advisory Council. And so we've talked about this before. There are 3 tiers to that. So we're looking at middle school students, high school students, and young adults that are between the ages of 18 to 24. And so we have been able to start our 18 to 24-year-old group with the Relatives On-Ramp program. We've met with this group. We've had 9 meetings and have had 79 participants participate in that. So this is really an opportunity for youth voice. We want to make sure that youth are at the center of what we're doing, that they're providing us with information about practices and policies and procedures, evaluating those existing things that are in place to make sure that we're doing what they need us to do. We are working to continue to expand so that we have the middle school and high school components. We're working with CMS and some of our community-based organizations that are already doing work with this same group of young people. Again, we want to establish rapport with those young people. We'll be collaborating with Breathe Inc. To do spoken word. And so a lot of our young people will have an opportunity to express themselves through spoken word related to violence prevention and how they think we should be providing safety for them where they're at school and where they're in their community. So again, we want to make sure that we are making recommendations to our stakeholders about the things that are important to our young people. Next slide, please. Handle with Care. Handle with Care is, we're excited about this. We have been trying to get Handle with Care in Mecklenburg County for approximately 3 years maybe. And we finally have it, everyone on board, and we were able to launch Handle with Care this school year in September. So what Handle with Care is a trauma-informed program, and it supports safe and supportive homes, schools, and communities for our young people. So it's an opportunity for us to address the traumas that they might be experiencing in community when they come to school and receive those services. So it's important to know that this is a partnership. And so again, we've talked about collaboration and partnership for everything that's happening in this plan. So you see the partners here, CMPD, Pat's Place, of course, CMS is listed, not listed there, but CMS, of course, because this is where we get our students from, Trauma and Justice Partnerships with Mecklenburg County, Recast Mecklenburg, and then the Office of Violence Prevention. So since the launch of this Handle with Care program, we've had a little more than, this number is a little off because it's since January, I think I maybe not update, 30 Handle with Care notices and about 48 students connected to those Handle with Care notices. And that number is, again, slightly increased. We have plans to expand to the entire school district. Half of the schools should be in place by the next school year, and the following year to expand to all schools in Mecklenburg County. Next slide, please. And so this is the list. So we started in the Freedom Division. The Freedom Division was selected, and let me explain why the Freedom Division was selected. What we really wanted to do was start in a learning community, but many of our learning communities span across several CMPD divisions. And so it was very difficult for us to do that. We wanted to start small with a pilot so that we could get it right before we expanded. And so Freedom Division was one of the divisions that included all of these schools, and we felt like it was a good mix of elementary, middle, high school, and it also included an alternative school. So again, with Handle with Care, with Freedom Division, we're able to provide these services to 8,786 students within this Freedom Division. We'll go to the next slide. So our Alternatives to Violence program, again, which is a collaboration partnership between county and city. And so what we've been able to do is expand this program. So our initial program started on the Beatties Ford and LaSalle corridor. And Youth Advocate Programs is the host organization that runs that particular site. Then we were able to expand to West Boulevard and Remount Road. Again, Youth Advocate Programs is host for that site. And then Nations Ford and Arrowwood and the Urban League for the Central Carolinas is the host organization for that site. So in the middle, you see that there are numbers of participants. And so I want to be very clear that a participant is someone that has agreed to enroll in the program. They are the highest risk individuals. That does not mean that the programs are not working with more people than that, but these are the people that say, I'm going to sign up. I want to be a part of this program. They assist way more people than the numbers that show there. So I want to be clear about that. So Beatty's Ford right now has 17 participants. West Boulevard and Remount Road has 8 participants, and Nation Ford has about 3 participants and are currently enrolling a few more participants. But again, remember that the West Boulevard and Nation Ford sites are new. And so again, they're establishing rapport in the community, getting people to know who they are and continuing to do work, but they have all been up and running and responding to incidences in their respective corridors. Some of the things that we want to be able to continue to do, and we've been able to do so far, is provide additional training opportunities for those staff members with ATV program. And so one of the things we've already done was provide every staff member in all 3 of these sites with Stop the Bleed training. And so we're able to make sure that if they are on the scene and there's emergent bleeding, that they know how to respond and could possibly save a life in that instance. We are also providing mental health first aid training that will be youth and adult for all the staff on all 3 of these sites, as well as providing them with Narcan training and access to Narcan so that they can administer that if it's appropriate. So I'll go to the next slide. So our hospital-based programs, again, we've had some expansion here. If you recall, the Atrium has their hospital-based intervention program that has been up and running for some time. If you look at the numbers here, in 2023, they were able to enroll 49 patients. Again, this is the same premise. Remember that people may not choose an opt-in to be enrolled into the program. It doesn't mean that they have not provided any type of service to them, but they have had 49 people enroll in their program since they started. And they currently this year have 4 patients enrolled since January. Novant is a new program. So we do have a second hospital-based violence intervention program through Novant, and their program is up and running and new. And so they don't have much data to provide at this point because they are brand new. But we're excited about that expansion. I will say that the hospital-based intervention programs do work and coincide with our ATV programs when it's appropriate and those locations match one another. Next slide, please. This is really exciting. I know a lot of people have looked and said, what are you doing on I-85 in Sugar Creek? Because that is a corridor that we have been plagued with a lot of violence and we've seen a lot of issues. We have assessed that program, this corridor. We are, as the Office of Violence Prevention, are connected to a national network of offices of violence prevention, which is hosted through the National Institute for Criminal Justice Reform, NICJR. As a member of that organization, we're able to receive technical assistance. So one of the things that we requested was for them to come out and do an assessment of the I-85 Sugar Creek area. And so that assessment consisted of meeting with our office, meeting with community partners that were working in that area, and looking at existing data and resources that were available in that area. We also did some observations and went out with community partners that are working in that area to observe what is happening in that corridor. Based upon that, we were able to list all of the issues that people that were residing or working in this corridor felt like were issues that needed to be addressed. We re-ranked those issues in a meeting earlier this week. And these were the top 5. We asked for top 3, but we had some that were tied. And so I wanted to show you that there is this web and this cross work. I think Sonia spoke about some of these same things that were issues, and these are certainly issues that people are bringing forth for the I-85 Sugar Creek. You'll see its unhoused population was what ranked number 1. Drugs and prostitution, access to mental health, trauma, and extracurricular activities for youth, things that were outside of the school hours or school year, and things that were outside of after school programming. And so those are things that we will be working collectively with community to address. And because that is what people have asked us to do. So next slide, please. Excited about a couple of new partnerships that we have. Our Daily Bread is a partnership that the Office of Violence Prevention has made. And this is an organization that uses baking to address social emotional needs, to address relationships between folks. They do a lot of work. And so it's hard to need bread and be mad. So that's one thing I always think about. And so we're excited to have a partnership with them where we're going to be able to host a lot of our young people that are high risk or at risk to participate in this program that we will be paying for. And so we're excited about that partnership. We have an additional partnership that we've established with the Macquarie YMCA. Macquarie YMCA has been so gracious to us to allow us to pay for memberships for young people that are high risk, at risk, their siblings, and a caretaker. So we want to make sure that, again, our strategy within the plan looks at support for youth and families, and we want to see that support across the board. And Shining Hope Farms does a lot of therapy through horses and just additional alternative ways to provide therapy and group sessions. And so they will be able to provide some of those same mental health services to some of our high risk, at risk youth here in Mecklenburg County. So we're excited about those partnerships and hope to develop new partnerships with other folks to see some of the same types of services. Next slide, please. I think that's all I have. That was a lot. So I will pause there and allow you to ask any questions.
So thank you, Tracy. Before I go to the committee members, we do have Deputy County Manager Trotman here, and I didn't know if you might have had any comments or add any additional context while you're here.
No, I want you all to, I want you all to be able to ask your questions of Tracy and all the great work that she's doing. It's so interesting and sad at the same time. I just received a report of another youth that died to gun violence at CMS today. So the work that we're doing is extremely important. As we have nurses in the schools that deal with these youth and that are impacted by it. So the work is extremely important.
Yeah, thank you for that. And certainly our condolences to that family and to our colleagues at CMS. And that's the exact reason why we need to have these discussions and move to action. So thank you. Here's how we'll do this moving forward. I'm going to start with Commissioner Meyer. We'll go to Commissioner Rodriguez-McDowell. We will go to Commissioner Powell, who's online. We will also go to our school board chair, and we should have plenty of runway to allow our community members to either ask questions or provide limited feedback, because we want to be respectful of everyone's time, and I want everyone to have the opportunity to be able to be heard, but it will be limited. You will be muted if we go into a diatribe that is intrusive on anyone else. So I just want to be clear on the way that I'd like to do this. So I want everybody to be respectful so that everyone can be heard that needs to be heard. So with that being said, we'll go again to Commissioner Meyer, Commissioner Rodriguez-McDowell, Powell, and then our chair, Snead.
Thank you so much. And I will be quick. I have two questions. Can we go back to the slide, the handle with care slide? I don't know what number it is. I'm sorry. If there was a number. I'll tell you, just keep going. That one. Okay. There are actually the next one, I think. Yeah, the next one forward. Yeah, that one. There are 8,786 children just in the Freedom Division that have been affected by violence in one way or another.
So no, that is just the number of students that are in that Freedom Division. So that's the total number of students that attend schools that fall within that.
Okay.
Yes.
So they're not all in the program, or they are?
No. So what happens with that program? So say law enforcement goes out to it could be a house fire, and they get permission from a caretaker for a child that they notice is there or experienced a trauma. They then send a handle with care note to that school that simply says, for instance, Tracy Campbell, handle with care. And then the teacher and the administrators know that if the student is struggling, having any difficulty, that they can automatically provide services or resources to that student without any question being asked.
Okay. And well, so this is the total number of students in the Freedom Division. How many students are actually taking advantage of the handle with care?
So it depends if they get a handle with care notice. So it would have to come
You don't have a
through.
number.
But right now, the last number that we had, the update was 30 handle with care notices.
Oh, okay.
Yes.
Oh, I'm sorry.
And that included 48 students.
Okay.
Yes.
And these programs, this whole presentation was about county programs, about our justice programs, correct? how many programs do we partner with, or do we partner with CMPD? Because I'm sure they have.
They're not
similar-
included in any of the
Right.
things that I've reported today, but we do have relationships with them and continue to foster better
Okay.
relationships with them.
Okay, all right, thank you.
You're welcome.
Okay, so I might just be a little slower. So I'm trying to understand the ATV, when you talked about the number of participants. Could you just go back over that a little bit? Because to understand the difference between, like what's a participant and, you kind of explained it, but I need more on that.
Okay, no problem. So what it is that our ATV staff will engage with a lot of people. They're looking to engage with the highest risk individuals, and they're looking to engage with the highest risk individuals that fall between a certain age range. So many of them are 14 to 24 is what we're looking at, that range. And in order to be a participant, you have to agree to sign up, right? You have to agree to say, I want to be followed, that I want to enroll in this program and participate with all of the things that it has to offer, which means some case management type pieces and actually literally hand holding them and walking through, setting some goals for them and helping them work toward those goals. Every person is not going to want to do that. They continue to work with those individuals, regardless of whether they want to enroll and be an official participant or not, in hopes that they can get them to become a participant so that they can explore the full range of services that are available to them.
Okay, so the numbers 17 plus 8 plus 3, I wrote down, which is it like 28 or something like that. What is the goal there? Like, is there,
So there really is not a goal. You want to work yourself out of a job. So, not having great big old numbers is not a bad thing, right? That means that you're not engaging with that many high risk young people in that particular corridor. So it can fluctuate from day to day. People can choose to become a participant today and decide that I'm just going to work alongside you and not be a participant for 3 months. As they're trying to work to get them to become a participant. So there's no real goal in mind. We have to think about what the capacity is to provide services and provide good services, long-term and consistent for people as long as they need the services. And so with limited staff, you have to be careful about the numbers that you can actually enroll and actually provide those services to.
Right, but we're using grassroots organizations to
Correct.
do that work. Okay, so, that I just would love to know more about that, but in the interest of time, the last page I think you had up where it had the extracurricular activities, like the top things they noted in the I-85 Sugar Creek corridor. Could you put that slide up? Because let's see.
Keep going.
Yeah, I think it was like the last one. Yeah,
Right
that
there.
one. Unhoused population. These are the top issues identified.
Yes.
What are we gonna do with this information? Like, is there like a follow-up to this?
Yes, so part of the follow-up that we did when we ranked these with the participants that came to this hotspot assessment, we looked at who is responsible for addressing these needs, making a list of those folks, kind of doing a landscape analysis to find out who is already doing work in this space. If we talked about unhoused population, who is already working with that group in this particular corridor, and then looking at what are we asking that these people to do. So we want it to be an actionable thing. So once we list who needs to be involved, what are we hoping that they are able to do, we will then work to convene those groups together to talk about what is existing, happening, and what new things, where are we missing, where there are gaps in services, and how we fill those gaps collectively. There are a lot of people doing a lot of work in silos, and this is an opportunity for us to bring people together and think about how do we address issues in a more collaborative fashion.
Okay, and what's the timeline for that?
We don't have a timeline established. We literally just did this ranking this week.
Oh, okay.
And so we'll be following back up with folks and asking additional people to come to the table to join us.
Okay, I'm not trying to rush you or anything. Thank you so much for what you do. I know it's amazing work, and I'm super supportive of it. And so thank you.
So thank you. Let's go to Commissioner Powell, please.
Thank you. I am in the.
We can barely hear you, Elaine. I don't think
Can you hear me now?
Not sure if it's our end or yours.
Can you hear me now?
No, it's lower.
Oh. Well, come back to me after Chair Sneed.
Okay, yep, we will go to Chair of our school board, Stephanie Snead.
Thank you so much, Chair Jarrell.
Steph.
Yes, can you
Stephanie,
hear
I'm
me?
sorry. I think it's something on our end. Give us a
Okay.
second to work out the
Okay.
technical difficulties. I will chime in and then I will come back to you guys. So one, thank you for the presentation. Couple things that I wanted to just share. I think, when we look at our lens from a county perspective, and you think about the social determinants of health and all of those elements, it seems like you're really the glue that interconnects and creates this web, this complex web that can tie into all of the other elements that we're dealing with, whether we're talking criminal justice, health, and all those other elements. I do candidly, I have to say, I feel like you may need a lot more support because when you look at the depth of what we're trying to deal with, so I'm curious to know how many people are working out of Office of Violence Prevention?
Currently 4, we're filling that 5th position in about 2 weeks with our new person starting. So we'll have a total of 5 folks.
What's the ideal number that we should have in a county of 1.1 million people? Because 5 sounds a little light.
That's a good question. I don't have an ideal number. I would say we would have to look to similar jurisdictions across the country to see what seems comparable in terms of the number of people that they're serving. Yes, that's what I would say.
So that's fair. I'd like to, when you guys do that analysis, I'd like to the committee to get that information so that we get a better perspective of what's happening. The other thing that relates to that, where are we seeing results across the country with this particular model?
There are a lot of places that are doing work. So one of the reasons we're connected to that national network of offices of violence prevention is so that we have support. That for the longest, we were the only office of violence prevention in the state of North Carolina before the state actually just opened an office of violence prevention. So we were really leaning toward a lot of these other places across the country who have been doing this work for a long time for support. So I think there are lots of places that we can look to. Some of them look a little different, even though they've been operating for a long time, their issues are different. So if you start looking at what's happening on the West Coast, it may be very different from what we're experiencing here in North Carolina. So really just trying to find some folks that are comparable, that are doing work. I think Indianapolis is doing some good work and they seem to be comparable to what we're seeing here in Charlotte.
Are we seeing result? I guess I'm looking for where you're seeing significant or substantial results.
Yeah, there's a new report that came out. There are a lot of folks that are seeing a lot of declines where we have seen a decline overall in violent crime, but the uptick in youth violence is what we have experienced here. There are people that across the country have been seeing a decline. And so really looking at what they're doing and how we maybe model some of those things here in Mecklenburg County, I think is what we need to be doing.
Okay, thank you. And for the sake of time, what I'll do is I'll send, I've got some other questions. I'll just send those offline and then hopefully the committee will get that information back. So let's try Commissioner Powell again, please.
Can you hear me now?
We got you. We loud and clear.
Okay. All right, I'll try not to be too loud.
Yeah. Inside voice.
Okay. So, it can be really difficult to get in touch with the right people. And I'm speaking on behalf of community groups and nonprofits that really want to be involved. Who is the best person for them to reach out to get notified when the JCPC RFP goes out?
So yeah, if they just want to reach out to CJS, I mean, we have a general email address, which is cjs@mecnc.gov. If they just want to reach out and provide us their contact information, we can add them to the JCPC listserv. And everyone on that listserv gets that notification when the RFP is out, as well as any other sort of announcements or events that the council is promoting.
Okay. And is there a website where with this information and the phone numbers for instance, for you, Sonia, and for Tracy?
So yes, there is a page on the CJS website that's specifically for JCPC. So if they do want to just go to the county website and then click on the Criminal Justice Services link from there, they'll be able to find all the information on the RFP as well as all the supporting documents in order to apply.
And absolutely, same thing for the Office of Violence Prevention. They certainly can go to our webpage from the county and get contact information for us. I'll also add that we have a Carolina Violence Prevention Collaborative, which is a group of community-based organizations that are working in this space. All of that information, even with the JCPC application, will be emailed out to those groups so that we are dually sharing information across the board.
Thank you. Thank you for your good energy and work on this. I have gotten more phone calls about this in the past 4 months than in the past 5 years. And so it's expanding, like my district marries up to Freedom Division and North Division, but also all the municipalities. How are you working with our towns? Like, I know you mentioned Pineville earlier. How are you working with the northern towns, especially Huntersville?
Is that for myself? Is that for Tracy or Sonia, or both?
First for Tracy, but both is good.
So right now, I'll say we have not had the opportunity to expand a lot into our townships. That is the goal now that we have more capacity to do the work. We're able to actually reach out to those townships. We have some interaction with them, but not to the rate that we'd like to see it.
Yeah, we're seeing a big change on Harris Boulevard. So I will conclude now for brevity, but thank you so much for this important work. I appreciate it. So Commissioner Powell, and I'll just add, as far as like representation for the towns, the police chiefs from all 6 towns do hold seats on the full criminal justice advisory group. So they do have that opportunity for any sort of input there. The police chief, Chief Hudgens in Pineville, he serves as the representative for all 6 town chiefs on the executive committee of the CJAG. And so they are, part of that group and have that forum there. In addition, with the community engagement task group, that group has expanded to be able to provide representation from both the South and the North. So there is a member part of that group there that is, I do believe, technically based in Cornelius, but does a lot of her work in Huntersville with a community-based organization there. So, the greatest need that we, is typically within, the city of Charlotte or Charlotte proper. But yes, but there is representation of the towns within the work that falls under the CJS umbrella. Thank you. And if you wouldn't mind typing in the contact information into the chat for anyone, because the people that are on the call, I know, are really engaged in the community and might not have your phone numbers. Okay, we'll get that. Thank you.
for that. We're going to go to, so we do know that there are questions in the chat. So we plan on getting to those, but right now we'll go to Chair Snead.
For now, mostly, thank you for the presentation. I will submit some questions after this meeting. But the initial question I have is, can you explain a little bit more about your connection with our law enforcement personnel? Meaning, is there a connection between the data that they have with the areas that are criminal hotspots, or the youth particularly that are engaging in criminal activity, so that to make some connection there for some type of intervention?
Yes, I'll start. I don't know Sonia had a response as well. We have a violence prevention data collaborative, which I cannot take credit for. It was started before I was into this role. And that is a lot of organizations, including CMPD, that have shared data agreements. And so we're sharing data together so that we can look at what are the trends and where are there gaps in services. And so we certainly are addressing that on a daily basis, looking at that data, but we have great working relationships with the data end on CMPD. So that drives a lot of the efforts that we're doing. When we look at where our alternatives to violence programs are placed. It was based on CMPD data that we reviewed to make those determinations about where were the best spots for us to initiate those things. So we're certainly using data every day to evaluate and determine where our initiatives and prevention efforts need to be.
So yeah, and I can just expand upon that with the, with the Data Violence Collaborative. I mean, again, there are a number of organizations that are part of that, CJS being one of those, public health. The folks from UNC Charlotte are also part of that sort of data steward group there. As far as, some of the other kind of greater, data pieces that are there, I would say some of the data that feeds into the warehouse within our department actually comes from the Sheriff's Department. So we do collect all of the arrest processing data that feeds into there. In addition to into that, I mean, when there are, sort of certain, projects or requests for, different analyses or whatever that might be. I mean, if that data is not available within, within the warehouse, we are able to work with our partners, which include, the police departments, to collect that data to complete, those analyses. In addition, on the juvenile side, most, CMPD, they are a recipient of some of our JCPC fundings for some of their diversion programming. So they do report, their, data attached to that program to the council. But also under that sort of Department of Public Safety umbrella with the juvenile data, the bulk of that actually comes from Department of Public Safety. So they do regularly produce and distribute, data and information on our kids that are court involved in the juvenile justice system.
Okay, that's all that I have for right now. I think the rest will take more time. So in the interest of time, Chair Jarrell, if you don't mind, then I'll submit some questions to your committee.
No, that'll be great. And I know that, you want to initiate further discussions jointly as well. So we welcome and are certainly open to that. So thank you so much. Commissioner Rodriguez-McDowell has a quick question before we go to the chat. Rebecca will help us navigate through the chat. Then we'll come back into the room. There may be, maybe public health has something, I don't know. Tanya, Ricky, you guys may have something as well. So I'll definitely give you all the opportunity as well.
I was just trying to look for the data warehouse 3.0. And so I went on the website, mecnc.gov, and then navigated to criminal justice. And so is that the portal or whatever that has Mecklenburg County arrest dashboards? It has like 3 dashboards or something.
So yes,
That's what you're talking about?
those are the public facing dashboards. Yes.
Okay, so that's the data warehouse that you meant.
No, those are the dashboards. The warehouse is much greater than
Oh,
that. So
okay.
yeah, so that's just, those are kind of like the daily, so what you see right on the dashboard, the data that comes through the warehouse, what you see on those dashboards, that data is 24 hours old. Although there are a couple that are offline right now in response to e-court. So we're doing some rebuilding, but the warehouse as a whole, it's more than just the dashboards. There's a lot of just data and a lot of coding within there that allows like my research and planning team to kind of connect and tie together cases and data so that we're able to kind of do more kind of broader analysis.
Okay, all right, thank you. Thank you, Mr. Chairman.
Absolutely. So Rebecca, will you help us navigate the questions in the chat, please?
Yes, sir. The first is from Bishop Amir Senior from Abundant Faith Worship Center, who first says, "Thank you, Elaine Powell, for the invitation. Here's the question for the group. Are there any youth prevention programs that coexist through sports? Having leaders pour into our youth through sports, for example, midnight basketball leagues, youth football, during the times when crime is high, for example, 11 p.m. to 3 a.m.
I would say yes. If people want to have some connection with those organizations, they certainly can reach out to the Office of Violence Prevention. Our Carolina Violence Prevention Collaborative includes a lot of people that are doing a lot of different things, but we do have a lot of folks that are connected that are doing work related to sports and youth and doing violence prevention in that way.
So and I say that there are a couple of programs through the Juvenile Crime Prevention Council that are funded that fall into that. There's one organization that's funded, which is called Trey Sports. It's a positive action programming. They focus a lot on interpersonal skill building, and most of their programming is, occurs after school. But that is one of the, the things with them is those kids that participate in their program. And if they meet their goals, they are able to participate in sports, and in Trey Sports, they have their own kind of organized like AAU basketball team. I've actually seen them play a few times. They're not bad. So, but that is one example. The council also funded another program this year called Youth Style Fitness. And so they have a couple of different elements that are geared towards, sports and physical fitness. And so, but yeah, those are just two examples that are currently receiving direct funding through the Juvenile Crime Prevention Council.
We also had a comment from Kelly, our colleague at Novant, saying excited to be a part of the conversation and reference their hospital-based new program. The second question is from Tasha Boyd. Great to see all the great work happening on the west side. Any plans to implement similar work on the east side?
So I think the goal is to really expand across all of Mecklenburg County. So we certainly don't want to have areas where we're focusing only on the west side, or it seems like that there might be focus on the west side. Certainly an example of that is an extension of our ATV program on the Nations Ford area, where the Urban League is doing that program. So again, we have to think about capacity to do that work and to make sure that we have community-based organizations that we're partnering with that can help us do that work as an extension of our office and as a part of the strategies linked to the Way Forward plan.
And I can tell you that Tisha Boyd, who had that question, runs a great program on the east side and utilizes Albemarle Road Rec Center. And so it's called Promise Youth Development. And I think they'd be willing partners to help us in any way.
They're part of our CVPC.
They're well established and doing great work. That's it. Okay, so I also want to give some runway for Dr. Kim Scott to be able to add any comments that she deems appropriate.
So I just wanted to be brief, firstly, in thanking Tracy for leading the public health efforts to initiate some of this violence prevention work, but also wanted to uplift that we do have a SAMHSA grant, the Resiliency in Communities After Stress and Trauma, the RECAST grant, which we have received extended funding. And I know Tracy mentioned it in her presentation, but it might be helpful for this committee to hear more about the work that's happening in that space, as there's a mental health component that I think is important to discuss when thinking about, the overall impact of community violence that could help support some additional planning for the body. So my priority was to also uplift that work is happening, and it might be helpful to get some insights on programmatic updates from that group as well.
Thank you for that. I want to come to the room real quick. I know we have community stakeholders here. Tanya, I don't know if you had anything, or Ricky, if you had anything, feel free to join us at the table if you got any comments or want to lend a voice to the discussion. No? Okay. I got you. Just introduce yourself, Rick, and feel free to.
Yeah, my name is Ricky Singh, Executive Director of My Brothers Keeper Charlotte Mecklenburg. We have a strategic partnership with the Urban League to help serve ATV over Nations Forward. No, I mean, I think my only comment is, I think Kelly was on the call from Novant because we had a meeting today. I'm constantly encouraged by the intentional collaboration that's happening across city and county between partners to really come together. To notice that there are similar challenges that are occurring, right? One, for instance, we spoke about today is when we think about the Nations Ford Road, Error Road area, the great work that Novant is doing, they're having a similar challenge of connecting deeper and more intentionally with the Latinx community. And it's, just on our call today, finding ways and intentional points of collaboration where we can come together around finding true anchors in that Latinx community over there to really partner with. We had a great event at Compare Foods, the new Compare Foods on South Boulevard, and hoping to dig some deeper roots there as well. But just want to thank city and county, and especially Tracy in our office, for helping to support it, helping to provide connections to other ATV sites and encourage collaboration. So appreciate it.
Yeah, thank you. Thank you for that. Going back to Rebecca now.
So there is one more. Are there any plans to support nonprofit organizations that sponsor smaller organizations who provide safe spaces for our youth? Sorry, hold on one second. FFM sponsors a youth basketball league and a dance team, but the funding to support them comes from our own fundraising efforts.
Is that,
It was Kenny Robinson.
repeat the question.
Sure. I
Kenny,
apologize.
Kenny,
We
are
had a
you
pop-up.
addressing that specifically to specific or just general question to everybody?
Specific to the Office of Violence Prevention.
Okay.
Can you repeat that question again? I want to make sure that I'm responding to it correctly.
The question is there any support available to medium to larger size nonprofit organizations to support the smaller organizations who creates safe spaces for our youth, specifically basketball leagues, dance teams, holding events on the weekends, creating safe spaces for our youth during those times. But those are smaller organizations who don't have the capacity to qualify for some of the grants that are issued out, that organizations like ours do have the capacity to funnel those funds through to those youths. We have not lost the youth in 2 years, in the last 2 years that we've been supporting them at the events that we sponsor for them.
Thank you for that question, Kenny. I think that Peacekeepers Academy is a perfect opportunity for some of those organizations, be they small or organizations that people like you might be supporting, to participate in, build up some capacity, some resiliency to continue to do the work. We want to support those small organizations, those grassroots organizations, and help them build so that they can operate on their own and independently, and that they have the capacity and the ability to apply for and receive funding from other places. So definitely touch base with me. We can connect you and talk a little more about what that looks like in terms of Peacekeepers Academy, because we are planning to host at least 2 more Peacekeepers Academy cohorts coming soon.
Thank you, Tracy, because some of these people that they're coaches and dance team instructors, they don't have no ambition to be grant writers, right? They just want to coach the youth. They just want to do the work that they do with the youth. They don't want to, become grant writers.
Kenny, that's a great point, and I'm glad you lifted that up. And again, to everybody who's listening, Kenny is doing great work in our community. His organization, Freedom Fighting Missionaries, is outstanding. So thank you for your work. Thank you for lifting that up. And it seems like, keep us posted, Tracy, on how the conversations go.
Absolutely.
Mr. Chair, if I may, the handouts or the slide deck from today's meeting are being uploaded for the public that may be tuning in virtually. They're being uploaded to the website for the committee on our MC, what is it? MC? Thank you. It's been a long day. Thank you. It is on the committee page, the presentation, so those can be accessed as well.
Okay, thank you for that. And I know we have quite a few people from the community. Seven, I didn't get a chance to see your comment, but thank you so much for being here. Thank you for your advocacy as well. We know how this issue has impacted you personally and your family, and our hearts go out to you. And we continue to stand with you as well. And for everyone in the community who's been impacted by this issue, we know it's not, you're not alone, because when one person in this community is impacted, we're all impacted in one way, shape, or form. When we lose someone, we're losing a tremendous amount of talent. And when we lose them tragically, it compounds that issue. So that's why we want to continue to have these conversations. Again, like I said in the beginning, we're going to have a series of conversations around this. We'll include the SAMHSA information as well, because I think that is critically important. So thank you, Dr. Scott, for lifting that up as well. And so I will allow my colleagues to have the final words if they have anything else that they'd like to share.
Sure. I would just say that, I really am encouraged that this is not a one and done, that we're going to continue and talk about this in chunks. I think that's a really great use of our time. I think the community, is sort of, crying out for action. And I think that we know that there's action. But when, it needs to be at a scale But you have to sort of build it. And I know it feels slow and people don't feel like they're seeing, huge results. But yet I think just what you presented, it gives me a great deal of confidence that, you're doing it in a methodical way that is going to be lasting and not just, just reactionary. And so I appreciate the approach that you're taking where you're, building those relationships and all of those things. It takes a lot of time. But I also know that there is an urgency that we need to meet. And so, the viewpoint that I come from, the glasses that I'm wearing are, how when can we scale up? How can we reach more people? How soon, and it's a feeling of being impatient. But I know, that we really are making progress, but it does feel like baby steps. And so just trying to balance, the urgency with the resources is the trick of everything that we do, isn't it? I mean, it's just across the board. So thank you for taking this on, and thank you, Mr. Chairman, for your leadership in doing this in chunks and having the conversation over time, not just a one and done. So I'm really appreciative of that. So thank you.
Thank you. And I also just want to say, I know you're walking up mountains, you're hiking up mountains, and I know what your jobs are so hard. And I want to thank you for what you're doing and what our leaders on the call are doing out there, your boots on the ground. And we know what you're doing and we appreciate it. I do want to see, and I don't know if this is part of the series, but conversation about how we are partnering with the city and where we're overlapping there. So I don't know if that's part of the series, but I would love to hear about it.
Yeah, absolutely. So let me be clear and give credit to where credit's due. The idea about taking this in chunks came directly from Starla. And again, it's an example of how Mecklenburg County staff works, right? They're doing all the heavy lifting. They're coming up with a great idea. So thank you, Starla. Obviously, your idea was a hit with this group and myself. So thank you for that work. And I do want to say thank you to both presenters today and for your work and your teams, and please let them know how much we appreciate that. I do want to double down on what Commissioner Rodriguez McDowell said. I mean, I wrote in my notes, scale, 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 scale. And so a lot of times we are really, really anxious to scale, but we need to know what support and resources you guys need as you move forward so that we can have the impact that we want. And to Starla, Derek, Mike and Rebecca, again, the staff that's in the room, we just can't thank you enough. Our Deputy County Manager Trotman and all of Public Health for being here. Thank you. Thank you all for your work and doing the heavy lifting on a daily basis. And to everyone who was able to join us today, remember, we're going to continue this conversation and we will interject the city and intertwine the city plus CMS in this conversation as well. And I think we may also have an opportunity to really bring our colleagues at a state level because we know this is an issue that's impacting communities across the state as well. And so I'm glad we have our colleagues here as well to hear this conversation.
Mr. Chairman,
Starla, then Tanya, and then we're going to adjourn.
Mr. Chairman, if I may, for Sonia and Tracy, we had a request in the chat. If there's the best contact information, if you could say that for folks that are listening in for your offices and your initiatives. So that's going to follow up. And then just right before we adjourn, I just want to run through our upcoming events. Or either I can.
Can Tanya
Yep, that's what I was
ask
saying
her
afterwards.
question first, and then we'll run through that and we'll adjourn.
So just real quick, as I hear you all talk about, especially talking to the city too, and then bringing in CMS, as you all have these conversations, is there then thought around creating a more unified strategy for our county as we approach this so that the county doesn't have its juvenile programs it's doing and then the city has its juvenile programs? I mean, is there something, or is there a way at least to have like a unified strategy between the different government entities? So.
I think that's a great point. I think the three of us would, but I think that's where CJAC comes into place to a certain degree. But I think we have also thoughts around that as well.
Yeah, for sure.
Okay, Starla, I'll turn it over to you.
Okay, thank you. And real quick, Tracy, what's the best way for if there's a website or it doesn't have to be a,
Starla, we did list
oh, we did it?
the
Okay.
OVP at mecnc.gov.
Okay.
And both website for
Okay, perfect.
CJS and OVP.
I've been trying to follow Rebecca's my shadow
Like,
person on
I
my
know.
email over there. We've been trying to keep up with each other. So thank you.
Mhm.
Just real quick, Mr. Chair, thank you for accepting ideas from staff and all of your wonderful comments. It is good work to do. It is a blessing. Just coming up, as you know, we are headed to Washington DC next week for our NACO Legislative Conference, and I'll send out an updated schedule highlights for all of you document tomorrow. And then our next IGR committee meeting, of course, is scheduled for the first Thursday in March, which is March 7th. The district meetings are coming up. And so that's on the bottom of your agenda. Just wanted to highlight those events coming up and see if you had any questions about the schedule or moving forward, or and also in the end, thank our state lobbying team NCACC for, we have 2 more meetings to go this afternoon. They're doing a great onboarding. And interestingly enough, the last note I'll say, and I know we're close on time, is that this issue has been discussed in our meetings. It is coming up. The Charlotte Regional Business Alliance Government Relations team had lunch with us. And this is one of the issues we talked about as well, community violence and how they could possibly partner from that end, the business end of the work that we're doing for our community. So we're talking about that in that scope as well.
Oh, absolutely.
So the plan that Tracy outlined is a unified plan. The steering committee consists of the city manager, the county manager, the chief of police, and the sheriff, and several others. So I just want to be clear that the way forward plan is a coordinated plan with both entities.
Thank you. Yeah, thank you for that. Appreciate that. So with that being said, thank you for a great discussion today, and I will call this meeting adjourned. Have a great day, everybody.
You don't have to vote. Motion to adjourn.